is Raven Richardson, and today I will be doing a sterile dressing change. So let's get started. So I'm gonna list the supplies that I would need. So I would need some normal saline, a boat of gauze, sterile gloves, a sterile drape, a ABD pad, a 4x4 gauze, a Q-tip. In a clinical setting, this would be a wooden Q-tip and it would be a little bit longer. Some tape, and in a clinical setting, this would be paper tape, and a pen. So let's get started. So up until this point, I have washed my hands, I have donned on clean gloves, and I have taken note of the old dressing. I've noted how they've done it. I've removed it. I've removed the gauze that was inside the wound, and I've noted how many gauze they used. I noticed the odor as well as any drainage that was on the gauze. So now I have thrown that away. I have removed my gloves, and now I will set up my sterile field. So first I'm going to open my sterile drape, making sure I use sterile technique. So pulling this away from me to keep it still. And I'm going to touch this, making sure I'm not going within an inch into it. So I'm going to open it like this, open it like this. Okay. So I would have washed my hands before I opened that to make the sterile field. So now I'm going to open up the rest of my supplies. So I'm going to open up my 4x4 gauze. All right. I'm going to open up my ABD pad. I will open up my Q-tip. I will open up my boat of gauze, but since the boat of gauze is not sterile, I'm going to make sure I leave it outside of the sterile field. Okay, going to place that there. And then before I don my sterile gloves, I'm going to take off some pieces of tape. Paper tape. All right. So since I've had that sterile field set up, I'm now going to don my sterile gloves using sterile technique. There. Okay. So since I'm right-handed, I'm going to start with my right hand. I'm going to open this up, making sure not to touch the inside of the sterile glove package. Okay, and these are cuffed, so I would use my non-dominant hand and pinch the cuff to slide in my hand, making sure not to touch the outside. Okay. And then I'm going to do the same for my non-dominant hand. Making sure not to touch the outside. Wrong way. Okay, so now that I have on my sterile gloves, I will get started. Before I don my sterile gloves, I would have poured saline into the bottle gauze to wet them. So I'm going to get a gauze, making sure it's just one. I would squeeze the excess saline out because you don't want any extra saline. And now I'm going to pack it into my wound. So I will use the side of the Q-tip. I'm not going to jab the wound. I'm just going to gently place it in there. Okay. So once I've done that, I'm going to place the Q-tip in the trash. And I would take my 4x4 gauze, put it on top of the wound. Depending on how big the wound is, I could use one or two, but since this is a fairly small wound, I'm going to use one. Next, I'm going to place my ADB pad on top of the wound. When I'm placing this, I'm going to make sure the blue line is pointed to the ceiling. So I'm going to place it on there, nice and gentle. Okay, and then I'm going to tape it. So you could either do a ladder method or you could do a window pane. I'm just going to pretend that I did the ladder method and tape it on there. This will be taped. Okay, so that's the sterile dressing change. So now that I've got that, I would have another piece of tape. On this piece of tape, I would put, if I can find my pen, I would put my initials, I would put the date, and I also would put the time. So once I've done that, I would place this piece of tape on the side of their wound. So if a doctor came in and didn't have his computer, or another nurse, they could see the last time the sterile dressing change was done and who did it and what time. So now that I'm done, I would clean up my supplies. So now I can touch this because they're not sterile anymore. So I would take this, I would throw it in the trash, and finally I would also document the sterile dressing change in the computer after I wash my hands. So that's my sterile video. Thank you.